Hello everyone and welcome to Inside Healthcare. October is Breast Cancer Awareness Month and we begin our program with a newly released study about a potential painful side effect that can linger for months, even years after breast cancer treatment. It's called lymphedema. And we're very pleased to have with us the doctor who did this study, Dr. Sandra Rosenberg with Health East Vascular Center and physical medicine physician and rehabilitation physician, and has a special interest in lymphedema. So pleased to have you with us.
Thank you for having me.
What is lymphedema to start off with?
Lymphedema, first of all, I have to tell you what the lymphatics are, because the vast majority of people, including medical care professionals, often don't even know what they are.
Interesting.
The average training in 4 years of medical school is all of about 15 minutes. So needless to say, I had to get very educated on it to understand what the lymphatics are. The lymphatics are part of the vascular system, and that includes the arteries and veins. Now, the arteries and veins take blood, oxygen-rich blood, from the heart down to your legs or arms, and the veins bring it all back. The lymphatics are the third part of that system, and they're responsible for removing any of the garbage that those arteries and veins don't want. That includes mutant cells, dead cells. If you think about our skin, for instance, it's exposed to everything in this environment. Bacteria, viruses, toxins, particles, gets between the skin cell spaces. Something's got to get rid of it. Our skin doesn't want to be sitting in it. And the lymphatics are responsible for doing that. And it does it through its main system of what we call superficial lymphatics that are near the top, that are vessels that bring that garbage material up to lymph nodes. And the lymph nodes are responsible for cleaning it up and detoxifying it, then sending it to other superficial lymphatics all over your body, to other lymph nodes to clean it up, and finally through a very roundabout way, getting it back to your heart so you can get it to your kidneys so you can excrete it. Now, lymphedema occurs where there's some type of disruption of that system. Lymph disruption causing swelling, lymphedema. And that can occur via many, many different things: trauma, infection, burns, surgeries, radiation. Now, with breast cancer, we end up often having some type of lymph node dissection, which can disrupt the lymph nodes, often in the axillary area up here or underneath the arm. And radiation itself can cause significant damage. So what happens is the outflow, the exit, has been made much smaller, and some of this fluid starts to back up. What does it have in it? Garbage, bacteria, viruses, toxins, particles. And that starts to cause inflammation, and over time that starts to cause scarring. And so you start to get even more lymphatic damage, and this can get worse, and people will start to notice swelling and lymphedema.
So it can be very painful. In fact, I've heard from other breast cancer survivors that's something that's still that they're dealing with years after they've had their treatment and stuff. So what can you do about it?
Well, first of all, I wouldn't call lymphedema really painful.
Okay.
It's uncomfortable, and it can ache, and it can cause a feeling of heaviness at times because you can't remove some of the garbage as much, including bacteria. People can have problems with infection. That doesn't happen that often. Most people do not have that problem. Only 32% of breast cancer survivors will, but it can happen. The first thing is making the correct diagnosis, and that involves a good history and physical. I think sometimes we miss that in medicine today, of actually talking to patients and really taking a look at them and examining them, finding, is this truly lymphedema? We will notice the complaints the patients often have. They'll feeling the feeling of heaviness and swelling. In addition, they may need, will notice the swelling. But what happens with this type of swelling, which is different than normal swelling, it doesn't have that bogginess. Normally, you know, if you have a lot of water fluid, you push down and you get a little dent in your skin. It doesn't happen with lymphedema because it's more of a scarring. What we can do about it is education, number one, and also do things, different types of treatment. There are treatments of therapy, which do massage and bandaging, exercises. Exercise is important in a lot of ways for breast cancer. So that's one of the other things we do. Compression can be helpful. There are certain types of pumps that can be helpful. The treatments will differ based on how severe the lymphedema is, what are the other aspects of a patient's life, including other medical issues. But we have a lot in our arsenal to start treating it, and there's a lot on the horizon.
So you have this exciting new study about lymphedema. Why don't you tell us about, what's it all about?
Well, this is a quality of life survey that was done in Sarasota, Florida at the International Breast Cancer Paddlers Commission race, which is a race of dragon boat racers who are all breast cancer survivors worldwide. It occurs every 4 years, and that's when all the dragon boat racers, the breast cancer teams, get together and race each other. And this was a cooperative study between myself at the Health East Vascular Center and Dr. Linda Kohler at the University of Minnesota, Department of Physical Therapy, and also the Dragon Divas of St. Paul, of which Jen Thorup was very helpful in getting this all together, and she's very involved with this study still. And what we did is we did a quality of life survey. We knew there would be this large group of all of a sudden 3,000 breast cancer survivors in one spot from the world. And we went and surveyed them and did a quality of life survey on them. And it is the largest. We got over 1,000 surveys back from 8 different countries represented.
Incredible. That's a really good return, yeah.
We are now starting to analyze the data. The first, we use, Dr. Linda Kohler has 4 students in physical therapy who are doing the analysis of the data. Our initial data was presented, our initial results actually were presented at the World Congress of Lymphology just about a couple weeks ago in San Francisco. I presented that. And what we initially were able to glean from the data, and this is very early because there's a lot of data still to be analyzed, but we were initially able to find is that of those patients who reported lymphedema versus those who had swelling but never had been diagnosed with lymphedema, many aspects of the quality of life, in fact all of them, were very, very similar. That included mental stress, it included physical functioning, sensation, pain, how it affected their social lives. So that's what we initially did, and hope we'll have a lot more data to present in the future because I really want to look at the different countries. Is there a difference culturally? What about those with lymphedema versus those that don't have lymphedema? And remember, these are all people that exercise very actively because they're dragon boat racers.
Mm-hmm. So if someone wanted to get more information about the study, it's not really available yet, but they could get more information about lymphedema, about the vascular center and that, and contact you. So how would they go about doing that?
Well, I'm obviously at the Health East Vascular Center through the Health East Care System.
And that's in Maplewood.
The Dragon Divas of St. Paul can be looked up, and they also will have information. Jen Thorpe is available through them. Actually, in the next newsletter of the International Breast Cancer Paddlers Commission, I wrote an article for them, so that will be presented to the breast cancer community. So that's the big way of getting the information, and hopefully we'll have more to report in the future.
Final comments for our viewers about lymphedema. What should they know about it?
Well, lymphedema is not curable, at least not at this time. There's a lot of research going on with it now. There's been a much greater interest. It should not control your life. It should not, people should not panic about it. Unfortunately, in the past, people would put them into very specific rules that you had to do this, and you had to do this, and had to do this, and it was very confining. That's not true. In fact, we found people can get out, live, it can be controlled, and exercise is extremely important. I'm a big, big proponent of exercise. As I tell my patients, a lot of us have had cancer, and I myself am a cancer survivor of 22 years. That's how I got into this. I had breast cancer 22 years ago. And what I tell my patients, you know what? We earned a life the hard way. We better go out and make the most of it and enjoy it.
Absolutely. Well, Dr. Sandra Rosenberg, thank you for being with us. It's been a pleasure to have you with us.
Thank you for asking me to come.
Thank you. Well, still ahead, we'll be taking a look at one of the fastest growing cancers and what you can do to protect yourself. Stay with us, everyone.
Engine.
Check.
Thrusters.
Check.
Fuel.
Check.
Computers.
Check.
Social Security.
No check, go direct.
That's right, Patty. A few weeks ago, I went online to godirect.org to sign up for direct deposit. It's easy to do, and I got my cash at warp speed.
Wow, it's fast and easy. I'll sign up right now to make sure I'm prepared for our next mission.
Recently, President Jimmy Carter announced that he was diagnosed and treated for skin cancer, the fastest growing cancer. Joining us is well-known dermatologist Dr. Charles Crutchfield III. Thank you for being with us. He's with Crutchfield Dermatology in Eagan. So thank you for being with us.
Thank you so much for having me today.
We've been told that he has melanoma. What do we know about melanoma? It's one of the deadliest cancers.
It is. And, when I talk about skin cancer, I'm also a professor at the University of Minnesota in dermatology, and I teach the medical students and residents I talk about skin cancer. There's three main types. The first main type is called basal cell skin cancer, and that's actually the most common type of cancer, barring all cancers in the world. There are over 1 million cases diagnosed every year in the United States. The nice thing about basal cell skin cancer is it rarely metastasizes and causes other problems, but locally it can be very destructive, and that's why it needs to be treated. So about 1 million cases. The second most common type of skin cancer is called squamous cell skin cancer, and there's approximately 250,000 cases diagnosed in the United States every year. That can metastasize in a small percentage of cases and lead to the patient's demise. And the third type of skin cancer is called melanoma. Now, there are only about 30 to 40,000 cases of melanoma diagnosed every year in the United States, but it is the deadliest form. Anywhere from 20 to 50%, depending on the study you look at, patients will actually die from this type of skin cancer.
So it is one of the fastest growing cancers, the skin cancer is, but we know if it is detected early, that survival rate is very high, extremely high.
Yeah, the earlier the better, and in fact, if you catch it very early, the survival rate is approaching 99%.
Wow, that's awesome.
And the thing about melanoma, it's the cells that produce color in your skin called melanocytes, so it's really the dark moles that are changing and they're prone to skin cancer, developing into melanoma. And we tell patients the things that you want to look for, we call a thing called cancer-prone skin. So if you have fair skin or blue or green eyes, blonde or red hair, if you have a history of working outside, say if you're working on a roofer, if you're a park ranger, if you're a lifeguard, lots of sun exposure, blistering sunburns, you're at high risk. Or if you have a family member with skin cancer, you're at high risk, and it's important to get your skin checked on a regular basis.
But everyone is at risk for skin cancer.
Absolutely. Some people are at a higher risk. And so what I recommend for everyone is having a baseline skin examination with your dermatologist, and based on your history and physical examination, they can recommend the appropriate interval for further examinations. It might be once a year, it might be once every 2 or 3 years, but that will determine how often you should be examined. Plus, you should be doing monthly self-skin checks.
So you mentioned briefly kind of what you should be looking for with the melanoma, but what other things what are the key messages on what are signs and symptoms of skin cancer?
I like to tell patients if you have any lesions that are changing in any way, size, color, or shape, or if they're becoming elevated, or if you have any spot that bleeds and doesn't heal on its own within 3 weeks. Now, if you're shaving and your razor catches and bleeds, that doesn't count. But if you're washing with a cotton washcloth and the lesion starts bleeding and it doesn't heal in 3 weeks, those are the things that you need to check out. And you'll catch 99% of all skin cancers if you mind those rules. Anything changing at all, or anything bleeding and not healing.
And the other symptoms, you wouldn't really notice anything else different?
Well, sometimes patients will notice unexplained blood in their bedding or clothing. You can investigate to see where it's coming from. There used to be an old promotional activity program from the American Academy of Dermatology, and they used to say, see spot change, see your dermatologist. And that's really the most important thing. Anything that's changing, and the vast majority of lesions that are changing are fine, but that's the point when you want to give the baton to the dermatologist and let them evaluate and let you know what's going on.
And there are certain areas of the body where you're more likely to develop skin cancer, the exposed areas?
Yeah, any area that you have sun exposure, the face, top of the ears, back of the hands, legs, are more common, but you can get skin cancer, and especially melanoma. You can develop it anywhere. So once again, any mole that's changing in any way should be evaluated.
So what can we do to protect ourselves against it besides being vigilant about checking our body for these signs and symptoms?
You know, in the old days, they used to say avoid the midday sun from 10 to 3. And I'm a realist. If you're going on vacation, you're not going to stay in your hotel room from 10 to 3. That causes to lose credibility as dermatologists. But what I say is be sun smart and enjoy the sun. That means wearing a broad spectrum sunscreen. And a lot of people are really key on the SPF number, which is good. You want an SPF of 30 or higher. However, that just protects you against burn. You really want to block UVA rays, and those are responsible for wrinkles and brown spots and skin cancer. So you need something that says broad spectrum or helioplex. Those are the things you need. And the key is to put a sunscreen on 30 minutes before you go out in the sun. It takes approximately 20 minutes for it to set up.
Good advice.
And then you need to reapply it every hour to maintain protection. And the most important thing, sun protective clothing. And there are great places that offer certified sun protective clothing to protect from the sun.
Well, any final comments about skin cancer that our viewers should know about?
Yeah, once again, get a regular checkup. If you notice anything changing, see your dermatologist.
Well, Dr. Charles Crutchfield, it's so Nice to have you with us. It's been a pleasure. And we'll have to have you come back when we can talk further about some of maybe the new anti-aging skin treatments that are now available and what works and what doesn't work.
It's been my pleasure, and I look forward to that.
It'd be great. Thank you. Well, still ahead of potential health risks during this time of year that you might not be aware of. So stay with us, everyone.
Chris Domine is a husband and a father. Chris is an athlete. Chris is even an Ironman. But 10 years ago, Chris was facing a very different story because his kidneys were failing.
Basically, the doctor said, if you don't get a kidney transplant and if you don't do dialysis, you are going to die.
Fortunately, Chris received a second chance at life, made possible by an organ donor.
You know, your well-being changes, you know, from loss of hope to better times ahead.
More than 100 million people in America are registered organ, eye, and tissue donors. People of every age and ethnicity, because they believe it's the right thing to do. Imagine what you can make possible by leaving behind the gift of life. Learn more and sign up as an organ, eye, and tissue donor. Go to organdonor.gov.
Our weather is changing, and it could pose an increased risk for seasonal vertigo, and surprisingly, it's among the most common reasons for emergency medical visits during this time of the year. To tell us all about it, we're very pleased to be joined back by Dr. Kurt Belk. He's the medical director and emergency physician with the urgency room. So thank you for coming back.
Thanks for having me.
So what causes vertigo and dizziness with the changing of our seasons?
It's actually pretty simple. The main reason is that this time of year, people tend to be back indoors. Kids are back at school. The temperature tends to drop, which causes our noses to run. We tend to and then touch a doorknob, shake a hand, and it's just spread from person to person by viruses mainly.
And vertigo itself, what is that?
So there are different types of vertigo, but most commonly vertigo is described as an inner ear disturbance. And what happens is that the brain gets different signals from your ear that it has difficulty determining where you're at within your environment. So your brain gets one stimulus from one ear and a different stimulus from another because of its being infected or inflamed. And you get this feeling of spinning or gyration that causes you to have difficulty with your balance, and then other associated symptoms can develop also.
And it does require sometimes going to the emergency room, or?
A lot of people come in because they think they're concerned that there's something else going on more serious than just simple vertigo. And it's difficult for somebody to determine whether it's something that they have to see a doctor for or not. And the recommendation is that you just come in and get checked out to make sure that it's not something more serious like a stroke or something going on inside your brain.
So you can't really tell the difference between them? They have similar kinds of symptoms?
They do. There are certain tests that you can do by doing a really good history, a complete physical, which our previous doctor talked about as kind of a lost art in healthcare today.
Yeah.
But doing that along with some maneuvers, there's a Dix-Hallpike maneuver that you can do that can give you an indication of some bouncing of the eyes, that can give you some determining whether it's from the central portion of your brain or whether it's peripheral and just an inner ear problem.
And what kinds of treatment is there available then?
And again, that depends on the type of vertigo that you have. Sometimes with an inner ear disturbance, you just have to retrain yourself, and your brain retrains itself by going through certain vestibular exercises. And so you concentrate on walking in a normal pattern. You concentrate on slowly getting up and transitioning from lying to sitting and then sitting to standing. Those types of things will help your brain retrain itself so you don't have this issue of the spinning sensation. That can be very difficult, especially when driving.
No magic pill that you can take that makes it go away?
Not necessarily. There's certainly treatments that can help with symptoms of vertigo, and there's medications. One is called antivert or meclizine. That's an anti-vertigo med that helps just diminish the symptoms and can help you function, and so you can do your day-to-day activities.
Are there certain people that are more at risk for developing this at this time of the year?
Yeah, the biggest risk factor for folks is advancing in age. As we get older, we have less elasticity. The organ in the inner ear that has the fluid, that is kind of our balance area, that tends to be less elastic, and you tend to develop vertigo easier as we age.
It's interesting. I was talking with my hairdresser about that. You were going to be talking about this topic, and she said, oh yeah, she has clients that can't lay down to get their hair shampooed because of this. So I was not aware of that. So what other information should our viewers know about vertigo this time of year, what they should do, anything they could do to prevent it?
Yeah, the biggest thing is just good hygiene. good hand hygiene, which is good throughout the cold and flu season.
Yeah.
That's going to diminish your risk of getting the infectious causes, which are the most common causes of vertigo. The other thing that you can do is when you get the symptoms that are concerning to you, I would recommend going in and seeing your healthcare provider that can help you distinguish between something that's more serious and life-threatening as opposed to something that's just going to be a little bit of misery for you to have to suffer through.
And if they want some more information about it or information about the urgency room, where should they find that?
You can get that on our website. There's a lot of different websites out there that have good medical information. WebMD also has some good information on vertigo. I actually refreshed looking at that this morning just because people want to hear what they read, and they want to know that what they're hearing and reading are similar from their healthcare provider to what they see on the internet.
Absolutely. Everyone goes right to the internet, don't they, for answers?
They do.
Yeah, I've got a sore throat. It must be something that I can find out what it is. So final comments about vertigo for our viewers.
I think anytime that you have an experience that makes you uneasy, that you feel threatened for, you should go in and get it checked out.
Well, thank you for joining us, and it's always a pleasure to have you with us. Thank you.
Thanks again.
So we're going to be back with some more, so stay with us, everyone.
You still texting?
Is this a real morgue?
Yep.
Shut up. Like with real dead people. Ooh, I gotta text Ashley.
Ashley identified you when you wrapped your car around that light pole because you was caring more about that thing than the road.
I knew she liked me.
Not anymore.
There's a reason it's illegal to text and access the web while driving.
Welcome back to Inside Healthcare. Now for some exciting news about the medical community in Vadnais Heights. We're very pleased to have with us Ling Becker, the Executive Director with the Vadnais Heights Economic Development Corporation. That is a mouthful. And Vadnais Heights, thank you for being with us, Ling.
Yeah, it's my pleasure to be here.
Why don't we start with what is the corporation all about?
Yeah, so the corporation is a private nonprofit. It's been around for about 30 years. And it is made up of investing businesses who operate businesses in and around the Vadnais Heights area. The business leaders engage in the Vadnais Heights Economic Development Corporation as a way to ensure the economic vitality of the area. And we work on many different issues that the business community is concerned about.
It really has grown a lot in 30 years. I mean, the community has really grown and prosperous. And
yeah, and the business community is constantly changing. And so that's one of the things that is of great value to us, is to stay in constant communication with our different business leaders. And we have many ways that we do that, but we're able to be more responsive to kind of the concerns and the needs, and also celebrate successes with them as well.
And in the last couple of years especially, it seems like a lot of new medical facilities and services that have opened up in Vadnais Heights.
Yeah, we're a great hub for innovative healthcare. We're proud to boast that to everybody. In particular, two of our businesses, the Urgency Room and Summit Orthopedics, they have really made the intersection of County Road E and I-35 E as a kind of a destination of sorts, and
sort
it really
of a
has
hub.
and of innovative healthcare delivery. And what that means for our community is a lot of the economic benefits of obviously having those amazing facilities is, obviously the jobs that they create, the visibility that it brings because they do a lot of advertising and that type of thing, but also the ripple effect of the patients and their families that visit those facilities really, spill over into the other businesses in the area.
Yeah, I would think it would be a thriving business to have in any community, especially, at this time, with more people than ever needing medical care.
Yeah, and I think people are more interested in finding these innovative deliveries that are quite a different experience than you would get in your traditional like hospital or emergency room. Top-notch doctors, care, while having a generally, I would say, a much more pleasant experience than one most people would expect to get when they have a knee replacement or have to do a trip to the emergency room. And they're rare, that these facilities, so like the Urgency Room only has a few locations, the Summit Orthopedic only has a few locations in the Twin Cities. So we are very fortunate to be able to have that type of destination in our community.
And talking about top, both the two that you mentioned, Summit and then the Urgency Room, are being recognized as finalists with the Minnesota Business 2015 HealthCare Awards. So that is incredible.
Yeah, it's really exciting that two businesses in a community as small as ours, really, in terms of population, are being highlighted in this significant way. Each year, Minnesota Business Magazine does a Leaders in Healthcare a set of awards. And so the Urgency Room is being a finalist for a Community Engagement Award, and they do an excellent job of, as Dr. Belk was just on the show, and many different avenues of how they communicate medical information that's useful for residents and patients and just general populace to be able to learn more about how to better care for themselves and questions they might have. So that's a tremendous award for them and an investment in the community that they continue to make. And Summit Orthopedic is up for an award as a finalist for their architecture of their physical space of their building. And
it's a beautiful
yeah,
facility.
And if you've ever been inside it, you would really want to stay for longer than probably they would let you. It's beautiful. It's comfortable. It's a place that somebody who does go through something as traumatic as a knee or hip or some kind of replacement, it's the type of place where you would want to have recovery there with the top medical professionals to take care of you while you're in this comfortable space.
Well, I know when you first contacted us, you were so excited about this, so that's very cool that Vadnais Heights is being recognized in this way with the facilities.
Yeah, and just the month previous, we Minnesota Business, they do different awards each different month, and last month they had manufacturing awards, and we had 2 businesses in the manufacturing awards as well. So we're celebrating with a lot of our businesses lately.
That's great. Yeah. So what's anything coming up that you're going to give us a hint and let us know?
Yeah. Well, we're an active organization. We've been hosting a series of community conversations, and folks can find out information about that on our website. That is focused on manufacturing and skilled workforce needs, and we're bringing together different stakeholders and different people to participate in a kind of a localized dialogue. In addition, on November 5th at the Vadnais Heights Commons, we have our annual dinner. Our speaker
That's always a great time.
Yeah, and we're going to have our own business awards that evening. And also, our keynote speaker that evening is Eric Dayton, who is a great entrepreneur who owns 3 businesses in the North Loop in downtown Minneapolis.
Well, very exciting things coming up for the community. So final comments about the Vadnais Heights Economic Development Corporation?
Yeah, well, I think it's just really essential for every community to have a group of business leaders that are so invested in ensuring that it's a good climate for operating business and that they invest in one another and in celebrating successes and working through problems. And a lot of times, you hear a lot of business advocacy and that type of thing happening at federal or state levels, but really a lot of change is able to happen across the table with your neighbors who are just down the road from you, and we're finding that that's to be more of the case than ever.
And it's so important for the health and of the community as well to have that strong economic development.
Yeah.
Well, thank you. It's been great to meet you and to have you with us, and thank you so much.
Yes, thank you.
And we'd like to thank you for joining us. We hope you can join us back next month on Inside Healthcare. We'll see you then, everyone.